Hey, I have a really fun topic for you guys today. I've had several pregnant patients in this week that told me that sadly they were told that they were experiencing lightning-like pain towards the middle to end of their pregnancy in their pubic bone region. Sometimes it shoots up into the belly, down, back towards the rectum, or down into the legs. And they were told it was normal, which, first of all, it is normal. There's nothing to be worried about, but there are some things that you can do about it. And it has been gifted with the lovely name lightning crotch. No, I'm not kidding. I don't think everything about pregnancy is as glowing and magical as it seems. I think it comes with some obvious discomforts. So I wanted to go over a quick couple of things you can do on your own at home to help relieve this pain. Many chiropractors, especially if they're trained in the Webster technique, are specially trained to treat you during your pregnancy to help prepare your pelvis for an optimal delivery, to help relax everything so the baby can be positioned properly inside of your uterus. And then there are a lot of muscle releases that can just provide you with comfort, help with reflux, and overall health during your pregnancy. So I have gotten my spine out to help us here. So basically this is the spine that I'm holding up. This is how it would look if I was see-through. So your pelvis is down here, and your pubic bone is that bone right at the very bottom of your front torso. So basically what happens is, obviously during pregnancy your belly expands to grow to carry your baby, and what it does is it can provide some pulling of your abdominal muscles, especially your rectus abdominis muscle, and that attaches right here at the pubic bone. So this is that bony area right here at the very bottom, and the attach is right there. So the number one thing that I want to recommend that you do is to press in on that area with your hands. And you don't want to press in this way. You don't want to be stabbing, this way. You want to use a flat palm and compress down. And so the position is going to be right down here. You can follow your hip bones down at an angle. And basically you're going to just be pressing on the pubic bone, and you're going to tilt your pelvis forward and back. So you're going to kind of do a tuck under of your pelvis and relax. Tuck under and relax. You can also do a crunch motion with your upper body, and while you're holding that area, you can release some of the tension around your pubic bone and the pulling of those muscles. Surprisingly, this is a pretty simple thing to do that usually gives you full relief. If you need a little help finding it or figuring out how to move while you're holding it, like I said, I highly recommend making an appointment with a chiropractor. So while I'm here, I wanted to touch on a couple of other things chiropractic can do. Basically, your whole pelvis has to expand as you prepare for delivery and giving birth. So what chiropractors do is we find different muscles that attach all around the pelvis. So that can include your hip flexors. That can include the round ligaments of your uterus, which live kind of here and here. And that can include what's called your sacrotuberous ligament, which connects your sacrum, this bone right here, to your ilium, which is these big hip bones on the side. So it runs from here to here. And we just loosen that ligament up. So it's a really relaxing process, and what it does is it allows for, imagine if you had a really tight ligament pulling from here to here, and you were trying to prepare the birth canal for opening, and it was just pulling and compressing this way. You're clamping down on an entire side of that opening, and it can be really uncomfortable. It can lead to your baby being in a breech position, and it can lead to things with really lovely terms such as lightning crotch. So when I had 3 people in 1 week come in and bring that up, I thought it's time to probably do a video and try to get the word out that there's something we can do to help this. They both received 1 visit worth of care and already had relief of their pain. Sometimes it can take a little bit more, but I highly recommend just looking into natural options for what you can do to provide yourself with comfort while you are preparing for a very important event. So if you guys have any questions, please drop those below, and I hope you found this video helpful. Thanks.